Good morning, everyone, and welcome to the National Hispanic Council on Aging webinar, Healthy at Home, Taking Care of the Whole Person. My name is Christine Perez, NHCOA's Director of Program, and it's my pleasure to be moderating today's webinar. So today's webinar will cover ways to support health at home, including nutrition, managing chronic conditions, and supporting mental health. The goal is to help caregivers and families support their loved ones' health and independence as they age. This webinar is in partnership with the Administration for Community Living, also known as ACL. So to begin today's agenda, it's my pleasure to introduce Dr. Janita Cruz. She's the President and CEO of NHCOA. She's one of the nation's foremost advocates and spokespersons for diverse older adults, and has been recognized for her commitment and leadership on behalf of diverse older adults nationwide. Welcome, Dr. Cruz.
Thank you, Christine. Thank you for your warm introduction, and thank you for everything you do every day for our community and for our older adults and caregivers. I, so much appreciate your dedication and your talent. So thank you for bringing us together this morning, and thank you to the panel members who are here today, the panelists who are here sharing your expertise. Thank you for making time this morning. And so I was really excited about this webinar when Christine told me about it, because it's an opportunity to talk about something we don't often focus on, which is, prevention, and what can we do within our reach that can prevent illnesses and can keep us healthy for as long as possible. So, this morning together, we will take a closer look at the aging process and how caregivers can be best supported, themselves supported, but, their loved ones as well. And so we do know that caring for a loved one is a meaningful and complex responsibility that extends well beyond ensuring their good physical health. And we also know that public health experts agree adequately supporting the well-being of older adults means going beyond physical health by supporting their nutrition, their social and emotional health, and their access to available resources and services. And so today, I would like to start by emphasizing something at the heart of healthy aging: prevention. In the United States, we have a tendency to be reactionary in our healthcare, as we attempt to fix problems after they occur rather than preventing them. Eating well, staying physically active, and managing stress are powerful tools that help prevent disease and reduce the risk of complications over time. And these actions are not just daily habits, they are essential for healthy aging. While these actions may seem simple and minor, they have a profound impact on long-term health and quality of life for all of us, for older adults and for caregivers. And at the same time, we must remember that knowledge is power. In a world with so much information at our fingertips, it's important that we be critical of that information and look for accurate, science-based knowledge we can trust. When we are informed, we are better equipped to make decisions that protect our health and support our loved ones. And it does take that well-informed decision-making to apply our knowledge to our everyday lives for the betterment of ourselves, for the betterment of our families, and of course, our communities. And I must also make clear the critical role that caregivers fulfill. And later on this morning, we will hear from others like Ocean, who will address in more details elements of caregivers that we should be keeping in mind. And these are the foundation of healthy homes and strong communities. Caregivers are. Yet their well-being is often overlooked. At NHCOA, supporting caregivers has always been a priority. We believe that caregivers are better able to care for their loved ones and protect their own physical and mental health when they have access to the right tools, the right information, and the necessary support. And so conversations like this webinar, are important because they provide caregivers with the opportunity to learn from experts and connect with reliable resources. We aim to ease your responsibility to seek accurate information and reliable tools with these events, with these webinars. They provide an opportunity to learn from experts with reliable resources and strengthen daily caregiving skills. We at NHCOA are committed to ensuring that our communities have access to the necessary tools and the necessary information to age with health, with dignity, and support. And so it is my hope that today's webinar leaves you feeling a bit more relieved and a bit more empowered to care for yourself as you continue to care for your loved ones and your community. And I invite you to continue to follow us on our social media channels for more information and to stay updated. Thank you once again. Thank you to ACL for supporting us and for joining us today. To all of you, thank you for connecting.
Thank you, Dr. Cruz, for your welcoming remarks. So now let's begin our panel session. Good nutrition is essential for healthy aging among older adults, helping them to maintain their strength, prevent chronic diseases, and support their overall well-being. Our first speaker is Dr. Gabriela Armendariz from Charlotte-Mecklenburg Food Policy Council, and she can speak more on this. So welcome, Dr. Armendariz.
Thank you, Christine. As always, it's always a pleasure and honor to be here. And I always thank NHCOA for this opportunity to share a little bit of the work that I've been doing. So can we go to my slides, please? Perfect. So when we talk about aging well, we often think about doctor's visits, medications, or exercise, right? But one of the most powerful tools we have every single day is food. So nutrition can help older adults maintain strength, protect bones, and stay hydrated. So, and all of this to support energy and preserve independence. So I also want to say clearly that this conversation is not about giving up on culture or favorite family foods. For Latino families, food is memory, identity, and connection. Healthy aging does not mean leaving that behind. It means making thoughtful choices with the foods and flavors you already know and love. Today, I will focus on why nutrition matters and more with age. The most important priorities to highlight and a few realistic ways Latino food traditions can support healthy aging. Next, please. Thank you. So as people get older, their bodies change in ways that make nutrition more important, not less important. Some older adults feel full more quickly or have a smaller appetite. Many also lose some of their sense of thirst, which means that they may not drink enough fluids during the day unless they are very intentional about it. And at the same time, as we get older, we also tend to lose muscle. And this is a natural thing of age, and that can affect strength, mobility, and independence. Another important issue is nutrient absorption. For example, many adults over the age of 50 years old do not absorb vitamin B12 from food as easily as they used to. So when another adult is eating less overall, each meal needs to work harder by providing more nutrition per bite. That is why nutrition-dense foods are so important later in life. The goal is not perfection. The goal is to build meals that better support the body changes that come with age. Next, please. So for time's sake, I will prioritize four nutrition priorities in older adults. First, and let me emphasize, first is protein, because protein helps older adults maintain muscle, strength, and independence. Second is hydration, because many older adults do not feel thirsty until they are already somewhat dehydrated. Third is calcium plus vitamin D, because these nutrients are important for protecting bone health. And fourth is fiber plus vitamin B12. Fiber supports digestion and overall diet quality, while vitamin B12 deserves special attention because absorption from food can become more difficult with age. These priorities are practical because they translate easily into real foods, for example, beans, lentils, fish, eggs, yogurt, milk, or lactose-free milk, soups, fruits, vegetables, and fortified foods when appropriate. This keeps the conversation concrete. We are not talking about abstract nutrition rules. We are talking about eating patterns that support strength, hydration, bones, and daily life. Next, please. Healthy eating does not require older Latino adults to give up on the foods that they feel familiar and meaningful. In fact, many traditional foods already provide a strong nutrition foundation. Beans and lentils, for example, are excellent because they bring both protein and fiber. Fish, chicken, eggs, yogurt, and milk can help support protein needs. Corn tortillas, rice, soups, vegetables, and fruit all can fit into healthy aging pattern when we think about balance, portions, and preparation methods. The message I like to always emphasize is this: keep the flavor, adjust the balance. That might mean using less lard, watching portion size, or reducing salt. And maybe in Latino communities, we love frying things, maybe avoiding those frying methods. It might mean pairing rice with beans, stew, and vegetables, or using herbs, lime, garlic, onion, oregano, cumin, and chile for flavor instead of relying so much on salt. Next slide, please. So when I speak to community audiences, I always try to leave them with changes that feel realistic. The first is to add protein in each meal. That can look like beans with eggs, lentil soup, yogurt at breakfast, tuna, salmon, chicken, or milk or lactose-free milk. The second is to drink on purpose. Many older adults do better when water is visible. So, and it's part of the meal routine. So instead of waiting until they feel thirsty, it has to be available so they can be drinking during the day. The third change is to reduce hidden sodium. A lot of sodium comes from packaged foods and restaurant meals, and not only from the salt shaker. So rinsing canned beans, choosing lower sodium products, and using less bouillon can make a real difference without changing the entire meal. These are the types of adjustments that support health while feeling practical and familiar. Small changes are often the ones people can sustain. And next slide, please. I will leave you with one message today, and it is this: healthy aging does not require a perfect diet, and it does not require giving up the foods that connect us to family, memory, and culture. What it does require is a little bit more intention. Protect muscle and with protein, drink fluids regularly, support bone health, watch hidden sodium, and whenever possible, build these habits with foods that still feel familiar and enjoyable. For Latino communities, especially, that is good news. Healthy aging can still taste like home. Small choices repeated over time can help protect strength, dignity, and independence. Thank you very much.
Thank you, Dr. Gabby. So to the attendees, please be sure to hold on to any questions you have during today's discussion and type them into the chat box. At the end of the panel session, we will have a question and answer session where we will have time to review and all the questions within the chat. So mental health and aging are closely connected, as maintaining emotional well-being is key to preserving independence, cognitive function, and overall quality of life in older adults. So allow me to introduce our next speaker, Mr. Richard Standifer, Director of Global Patient Advocacy at Bristol Myers Squibb. Today, Mr. Standifer will highlight mental health and aging. Welcome, Mr. Standifer.
Thank you so much, Christine. When you're caring for someone as they age, especially when things like memory, behavior, or mental health begins to change, you come to expect that the condition itself is going to be the hardest part. What you don't expect as a caregiver is how difficult it is to navigate everything around the condition, the appointments, the terminology, the referrals, the moments where you're trying to describe something you've never had words for to someone who needs precise words in order to help you or your loved one. I cared for both of my parents through their respective diagnoses with dementia when they were in their 80s. And what I carry with me from that time still, from that experience, is how much falls on the family long before they know where to turn or even begin to think about turning to more intensive health care. And that's not just my experience, it's what caregivers across communities and across the globe are telling us today through research and through lived experience. The uncertainty, the language, the system itself. What I think a lot of us have come to appreciate, both from personal experience and in the work that we all do here, is that those challenges are greater in communities where language, culture, trust, and access actually create additional layers of difficulty. In some communities, there isn't even a word for what a loved one may be experiencing in terms of their mental health. And without language, it's hard to seek help. Without trust, it's hard to accept help. And without access, none of the rest really matters. So when we talk about mental health and aging, and we're thinking about the individuals we all want to support, we're not just talking about the diseases, the conditions. We're talking about whether patients and the people who love and support them can recognize what's happening, describe it, and get a response that actually helps. Families, as we know, and we hear already, are the first to notice when things go, and the first to carry the burden of that throughout. One of the challenges we hear consistently from advocates, from patients, from caregivers, is how difficult it can be for families to recognize when something has changed and to know what to do next. Changes in mood or behavior, memory, or personality don't always come with clear labels. They can be gradual. They can be dismissed easily as stress, or unfortunately, they can even be dismissed as just the natural part of aging. And we've just heard from the doctor, there are ways to age normally and naturally. There's even often a long time between when a family first senses something is wrong and when they find the language and the confidence to bring it to a healthcare professional or provider. And when families know something isn't right, even describing those changes in a way that leads to clear answers is really a skill that most of us were never taught. Medical terms and healthcare jargon is precise for a reason, and it has its place, but it doesn't reflect how patients and caregivers and families actually experience what's happening day to day, and certainly not how they think or talk about those things. And when families can't find the words and the bridge between their words and the system's language isn't really built so well yet, the right conversations never happen. And without the right conversations, the right care is harder to reach. Here's something that scientists keep telling us and keeps coming back to, and it matters for how we think about the aging population. Mental health and brain health, how we think, are biologically connected. I'm not a scientist, but what I do understand is it's the same systems in our brain. Um, Conditions like depression, anxiety, prolonged social isolation, those don't just affect how someone feels at a given time. Over time, they can affect memory, thinking, day-to-day functioning in ways that are measurable and meaningful. So the point here is that mental health, cognitive health, brain health, they're not separate issues, not for patients and not for caregivers, which means we have to address these things not in isolation, but together and holistically. We have to address these things in how we design research, and I'll talk about that a little bit more. And we have to address these things holistically in how we talk to each other and how we talk to families. We have to look at the full picture of what someone is experiencing on the emotional level, in their thinking, socially, all of that, if we want any hope of intervening earlier and more effectively. In my role in patient advocacy, I have the opportunity to hear directly from leaders from patient advocacy organizations, patients themselves, caregivers, and from all kinds of communities. And what strikes me is not the variety of things that I hear, it's the consistency. People often seek help later than they would like to, not because they don't care, but because they weren't sure what they were seeing warranted calling someone, they weren't sure who to call, and they weren't even sure if they'd be understood if they did reach out for help. Mental health concerns, especially in older adults, can go unspoken for a really long time. Stigma, of course, we think of, pride, and in some cultures and some families, you protect your elders by not talking about certain things. You don't name these things. Caregivers carry more than most people ever see. The emotional weight, the logistical weight, the grief of watching someone you love become someone unfamiliar, and the labor of trying to figure out how to navigate clinical settings, healthcare systems, that can fall heavily on a caregiver, often at the exact moment they have the least capacity to do that, which goes to the self-care there, as we've heard earlier. Families carry more than we ask them to, and more than most of us will ever see, and why it's so important that we do our best together to make sure that journey is one that can lead to good outcomes. I represent a pharmaceutical company, and I think it's fair to ask, what role does industry play here? We don't control the system, but we are a part of it. And that comes with real responsibility. One of those responsibilities is how we communicate. We've been genuinely challenging ourselves as a company to make health communication clearer, more compassionate, and more actionable for every patient. One example of this is work we've done around what we call universal patient language. This is a content development framework. It's built in partnership with patient communities across the globe. And it's really meant to help content creators break down complex medical information into plain, accessible terms and imagery too, not just words, but what you see too in terms of image. This is not about dumbing things down. It's not stripping out important nuance, but it's really making sure that the words we use are clear enough to understand, supportive enough to trust, and relevant enough to act on. That's across languages, cultures, and communities. If someone can't understand what's happening or doesn't have the words to describe what they're seeing or experiencing, the clinical system can't really help as much as it could. And that's an area we take. We take some responsibility to address in the way that we can from where we sit. Beyond how we communicate, there's the question of how we're learning, of who we're learning from, actually. We're putting more intentional focus on ensuring that the research we do reflects real world populations, not just in who is recruited to participate in research, but in how the studies are designed from the beginning. What questions are asked, what outcomes are measured, and how the patient is truly at the center of the study. That work continues. We are always learning from it. I won't pretend that we've solved it all completely at this moment, but we take it quite seriously. We take it quite seriously and continue to do the work. And finally, none of this works without genuine partnerships. Organizations like NHCOA are essential partners in helping us understand what actually matters to communities and how to do this work in a meaningful way. If there's one thing I've come away with in my time as a caregiver with lived experience in dementia, and as someone who works in this space and deeply committed to it, it's that many of the biggest barriers in mental health and aging aren't the conditions themselves. It's the space around the conditions, how we understand what's happening, how we talk about it or don't, and how we find the language, how we find the courage to seek care. What this space keeps teaching us through research, advocacy, through families living it, is that communication is not secondary to care. It is really where care begins. It is where it stalls, unfortunately, and it is where, if we all get it right together, everything else becomes possible. For alongside every patient, often, sometimes, there is a person, the one who noticed first, the one who made the phone calls, the one who sat in all those waiting rooms. In so many cases, that person is the system, and we need to care for them. Thank you so much.
Thank you so much, Mr. Standifer. So once again, please feel free to write your questions in the chat box until our question and answer session at the end of today's webinar. So to continue with our next presentation, so caregivers have proven to be a vital role for any older adult's healthy aging. Family members and paid caregivers provide daily support, manage complex health needs, and help older adults live full lives. Tools and resources from healthcare providers can guide caregivers so that they can better navigate challenges as they arise and also to avoid burnout. Now let's hear more from our next speaker, Mr. Ocean Lei, Programs and Communications Manager at the Diverse Elders Coalition, or also known as the DEC. So today, Ocean will speak about the DEC's caregiving toolkit and more. So welcome, Ocean.
Thank you, and thank you for the introduction. I just want to say before I get started, to the two panelists or speakers before me, thank you for what you do and what you share. I think it's important to frame my conversation in a way that, this is the reality that diverse family caregivers are dealt with right now that makes it so difficult to carry out what the speakers before me talked about, whether it be, having the education to eat well and follow nutritional guidelines that will benefit their health, or have the conversations and have the trust with formal support networks to ensure that their aging loved ones can age gracefully with dignity and respect. And so I just want to frame that, and a huge shout out to the two panelists that spoke before me. But yeah, so thank you for having me today and that introduction. I know my hair is a bit longer than the picture you saw, but I'm still the same Ocean, and I'm glad to be here today to have an important conversation around healthy aging from both a mental and physical health perspective. Before we dive into the DEC's or the Diverse Elders Coalition's research, just wanted to provide some background information that's vital in terms of allowing us to carry out our research that ultimately informed our curriculum and toolkit. So the DEC was founded back in 2010 to ensure that the unique needs and perspectives of diverse older adults would be heard when and where it mattered. We realized that our collective voice was stronger than our individual voices, and so that's how the DEC was formed. Together, we're made up of 6 different member organizations who represent racially and ethnically diverse people, American Indian and Alaskan Natives, and LGBTQ plus people. And together we advocate for policies and programs that center diverse older adults and improve aging in our communities. Next slide, please. So here's a visual representation of our 6 member organizations who are at the heart of the work that the coalition does. I would say it's our value proposition. Without our member organizations that you see here on the screen, we wouldn't be able to carry out the research that we do. I won't get into all their names, their acronyms, but just know that the National Hispanic Council on Aging, or NHCOA, is a vital coalition member, as you can see here on the screen. These organizations represent millions of diverse older adults. These organizations are national leaders with innovative and culturally affirming practices that laid the groundwork to carry out our research, the trust to carry out our research. And together with these 6 organizations, we represent African American and Black people, American Indian and Alaska Native, Chinese and Korean American people, Southeast Asian American, Hispanic, Latinx, LGBTQ+, and direct care workers. Next slide, please. So now going into the research, as Christine mentioned, I'll be talking about the toolkit today, and this is the research that informed the toolkit and some of the different programmatic resources that we developed. At the end of 2018, we received a research grant from the Johnny Hartford Foundation called the Caregiving Initiative to analyze existing research, generate original research, and develop policy and programmatic solutions to meet the needs of diverse family caregivers, which is still ongoing today. So this was our 2019 research process. We held 18 stakeholder interviews with providers across the nation to learn more about what this curriculum, what this training, what this toolkit needed to cover. With that, we translated a national caregiving survey into 8 different languages and held more than 1,000 survey respondents across 6 different diverse groups represented by the DEC, the ones that I just mentioned earlier. We also held 36 in-language focus groups across the country with diverse family caregivers to learn more about their needs and to cover nuances that quantitative data couldn't, aka the survey. All of this work went to inform the development of the DEC's curriculum and toolkit that will be shared later today. Next slide, please. As I mentioned, this research is still ongoing. Understanding that no one becomes an expert in cultural humility or competence, as some know it, and the changes in the caregiving landscape due to diversity and events such as the pandemic. The DEC conducted a literature review in 2025 to ensure that our original findings were still relevant today and to be inclusive of other groups such as LGBTQ+ people of color and direct care workers, aka people living at the intersections. We understand that in our diverse communities, people just don't hail from one diverse communities, they hail from multiple. And so that's why we did the literature review, to ensure we account for those intersections, knowing that they deal with multifaceted compounded stress that we didn't capture in our original research. Next slide, please. So now we'll go into some of the findings or takeaways from the DEC's research. The The research itself covered a range of issues regarding diverse family caregivers and older adults, but today we'll be focusing on key takeaways related to today's webinar. As you can see by the title, what whole person healthy aging requires for diverse caregivers. I think I messed it up. It should be from diverse caregivers. But we'll cover the prevalence of these issues, different issues that previous panelists talked about, what needs to be resolved or required to ensure older adults and family caregivers can achieve healthy aging. So to start with the first bullet point, healthy aging at home starts with healthy caregivers. This is really the reason why we started this research in the first place. As I mentioned, we were founded in 2010, and as we delved into our work at the DEC, we quickly realized that if you can help improve the health and well-being of family caregivers, it will ultimately improve the lives of the ones they are caring for, which oftentimes is an aging friend, parent, or relative. We understood, and the research confirmed, that caregiving is a health issue for caregivers themselves. In our research, more than 1/5 or 23% of survey respondents, and as I mentioned, we had over 1,100 survey respondents. 23% of survey respondents reported feeling more health strain, which encapsulate both physical and mental health strain because of caregiving. More than 1/4 of survey respondents reported feeling more isolated because of caregiving, and 14% of them developed symptoms of depression. When caregivers are both physically and mentally strained, it's difficult for them to carry out tasks related to caregiving. And this is only the beginning, as we dive deeper into the other bullet points you see on the screen here. So it's important to resolve caregiver mental and emotional health strain, as it directly affects their ability to care for their aging loved ones at home. Next is how caregiving is shaped by culture, family responsibility, and lived values. Especially for diverse family caregivers, cultural values have many implications to how they manage their own health and the way they deliver care. And so it's very important that providers and community members understand these cultural values when thinking about caregivers or diverse family caregivers' behaviors regarding their own health and how it affects their own well-being and the well-being of their aging loved ones. In our 2019 caregiving survey, half of respondents said that their culture expects them to care for aging loved ones. And with that, 43% said that they were the only person helping their care recipient. I put those two stats together because a lot of times in diverse communities, whether it be familyism, the needs of the family overrides your personal needs, or filial piety, respect for one's elders, caregiving solely falls on an aging parent's kids or young adults. And oftentimes, these young adults, they take on this role very seriously without any help and even neglecting their own health to do it. They don't even know what they're doing for their aging loved one is called caregiving, and that there are formal supports to help them care for their aging loved ones, which often leads to them not utilizing formal supports, which we'll later cover. And again, this was further confirmed in our 2025 literature review across multiple communities where cultural obligations and faith-based values can lead Black caregivers to provide unpaid care with fewer formal supports. We'll go into the specific statistics regarding our own research in a moment. So we just talked about how culture and value can impact the health of caregivers. What often come with that is language, right, in diverse communities. And language access is a whole person health issue. It's not just an extra service that we provide for and we can be proud of. We should be providing that, especially in the United States, where it's a melting pot, as a lot of people like to say. The last time we checked this statistic, more than 5 million adults in the United States are limited English proficient. I like to think that I don't like to think, but I know that number is higher now. And limited English proficiency worsens the caregiving experience. In our research, Asian American, Pacific Islander, Southeast Asian American, and Hispanic Latinx caregivers with low English proficiency reported significantly higher psychological distress, which we'll dive deeper into the next slide because we have a whole study around that one. But yeah, limited, no, you can go back. Go back up slide. Yeah, sorry. That'll be a surprise for them later. But yeah, limited English proficiency amongst diverse caregivers lead to lower level of self-identification, which in turn affects their interactions with formal support networks for both themselves and their aging loved ones. In our surveys, respondents who reported difficulties with cultural tasks or had limited English proficiency, such as translating or interpreting at the doctor's office, on average use 0.64 formal supportive services. So essentially not even one supportive services to help them. So accounting for language is extremely important. Language assistance and culturally humility is vital for helping caregivers get the supportive services they need to navigate health systems effectively and safely for their aging loved ones. Because as you can see in the next bullet point, because without resolving these issues, caregiving as a health issue, as I previously mentioned, and as an obligation will only worsen. And that's why I included it here. Social isolation and limited supports make caregiving harder and less healthy. I know we talked about how cultural values and limited English proficiency can lead to social isolation and limited support. But negative effects of social isolation and limited supports is true for all caregivers, regardless of the communities you represent. Whatever the reason for social isolation, whether it be because of discrimination or lack of family and friends to help, half of those who reported social isolation in our survey use one or fewer supportive services, worsening their own health and the care they deliver to their aging loved ones. One can start to see a vicious feedback loop between isolations and supports, and how if we don't begin to resolve the root of these issues, the physical and mental health of family caregivers will deteriorate, which then carries over to the health and well-being of their aging loved ones. So what can we do? Through conversations with providers, family caregivers, and older adults in focus groups, one way to alleviate these issues is to utilize trusted community-based and culturally responsive supports to improve outcomes. It's important to understand in diverse communities that these issues do not occur in a vacuum. Our communities rely on informal support networks and don't use formal services because of historical discrimination, racism, and other isms and phobias that have led them to distrust formal support networks. So rather reinvent the wheel, we must work side by side with these communities, whether it be learning from community-based organizations who are already doing this work, or building out a workforce that reflects the community you're working with. Because when diverse communities see themselves reflected in the people they go to for formal care, they're more likely to open up because they feel that that person they're speaking to understand the cultural and linguistic nuances that they're dealing with. Lastly, I just want to talk about financial and systemic barriers. In our survey, 35 of respondents said they paid for caregiving related expenses out of their own pockets. Other groups were hit especially harder, making more than 50% paying out of their own pocket. Obviously, these financial burdens spill into caregivers' own health, with them skipping medical care due to financial caregiving strain. And these numbers exceed 30 to 40% when you're talking about specific diverse communities represented by the DEC. And so it's important to note in this webinar, because whole person help means caregivers need access not just to information, but to services, navigation help, and systems that do not force them to sacrifice their own health to care for someone else. I think my time is up on that. So I'll pass it back to Christine.
Oh, thank you, Osha. But no worries, you can go further with that slide. And for more information about where people can receive more information about this toolkit.
Yeah, so thank you, Christine. I just want to include this slide, as I mentioned earlier, because of the current environment we live in, and also to show how important it is to account for cultural and linguistic values for our diverse communities. In our survey, caregivers reported some or more difficulties with cultural tasks, which we defined as translating health information, interpreting information at the doctor's office, or navigating immigration or naturalization systems, had higher levels of depression and 4 types of strain, including social isolation, health strain, relationship strain, and work strain. This was a significant association with a p-value of less than 0.01, which means this held true regardless of the racial or ethnic or diverse background that you're from. And so any caregiver dealing with cultural task difficulties likely have higher levels of 4 types of strain and depression. And yeah, I just wanted to include this because, whole person health goes beyond the medical aspect and counting for one's culture and language. But yeah, that's basically it. The next slide just shares more so our toolkit and, opportunities for additional learning. This toolkit includes everything that I talked about today, obviously in a more detailed version. We just, and the link below is our curriculum that helps providers better improve their multicultural capacities when working with diverse family caregivers. And I just want to say the National Hispanic Council on Aging had a big part in developing that curriculum. And so, yeah, it's we developed it in 2019 and it's still ongoing today.
Thank you, Ocean. And just in case people want to reach out to you directly, what would be the best email or phone number that people can reach out to learn more about this toolkit?
You could just reach me at ole@diverseelders.org.
Perfect. And also your website, right?
Yeah,
Diverse
the website,
Elders.
yeah, or info@diverseelders.org, which will sort of go to me as well.
Thank you, Ocean, for your presentation. So to continue with our last presentation for today is we will talk more about caregiving. So caregiving is especially important in the Latino communities where family often plays a central role in supporting older adults. So many Latino caregivers, I think, Christina, I think you can mute yourself. Thank you. So yes, many Latino caregivers balance work, family, and caregivers' responsibilities, often without the help of available resources. That's why providing culturally relevant guidance, support, and tools can help to protect the caregiver's own well-being while they continue to care for their loved ones. So our last panelist is Cristina Pacheco. She's NHCOA's Director of Policy and Research Development. Today, she will be highlighting caregiving among Latinos. So welcome, Ms. Pacheco.
Thank you, Christine. Good morning, everyone, and thank you to NHCOA for creating this space. Can you share my slides, please? Perfect. So I am really honored to be here today to talk about caregiving among Latino families and what it looks like, what it requires, and how we can better support caregivers. This topic is deeply personal to me. As my parents get older, I am finding myself stepping more into that role of a caregiver. And like many people, I'm learning what it really means in real time. And that's why I really want to start with a story. Next slide. So Rebecca is a daughter, a mother, and a full-time employee. Recently, her father moved in with her after a hospitalization, and overnight, she became his full-time caregiver. She manages medications, schedules appointments, cooks meals, and makes sure that he is okay while showing up for her job and her family. No one trained her for this. No one walked her through what to expect, and no one asked what support she might need. And most importantly, no one has asked her how she's doing. Rebecca is doing this out of love, but love shouldn't mean doing it alone. Rebecca is not the exception. She is the reality for many Latino caregivers. Next. And this matters because the need is growing fast. Latinos are among the fastest growing aging population in the United States. And with aging comes an increased need for care. At the same time, Latino communities experience higher rates of chronic disease, like diabetes and heart disease, conditions that require ongoing caregiving. So the question isn't if caregiving is happening, it's who is carrying that responsibility and how are we supporting them. Next slide. There are nearly 8 million Latino caregivers in the United States. Compared to other groups, Latino caregivers provide more hours of care, are more likely to be unpaid, and are often balancing multiple roles at once. This is not occasional help. This is sustained and intensive caregiving. Next. Latino caregiving is deeply rooted in cultural values. Familismo emphasizes a family responsibility and connection. There's a deep respect for elders, and often multiple generations live together. These are powerful strengths. This is something I see in my own family. The expectation that we show up for each other, no questions asked. You always have someone you can rely on. But we have to be careful because strong values don't mean unlimited capacity. Next. The reality behind the strength is that there is a hidden burden. Latino caregivers experience high levels of stress and burnout, financial pressure, especially when reducing work hours, and many delay their own healthcare needs to support those that they are caring for. And importantly, this burden falls heavily on women. So while caregiving is rooted in love, it's also physically, emotionally, and financially demanding. And I'll be honest, even as someone who studies this and works in this space, I still find myself asking, am I doing enough? And am I doing this right? Next. So why aren't caregivers getting support? It's not because they don't need it. It's because systems aren't built for them. Common barriers include things like language access, which we've heard about a lot today, lack of culturally responsive care, fear and mistrust of systems, and that is continuing to grow, unfortunately, and not knowing what resources exist. And underlying all of this are structural inequities that limit access to care. I see these barriers in my work, but I also see how easy it is for families like mine to fall into the same space of trying to figure it out on our own. And let's be honest, society doesn't always make time for trying to figure these things out. Schedules are already complex and busy. Services aren't always offered at convenient times. And so navigating those systems, particularly when doing it alone without a roadmap, can be incredibly challenging. Next. Additionally, as we've heard, caregiving takes a serious toll on mental health. We see increased rates of anxiety, depression, feelings of isolation. But there's another piece that doesn't always get talked about, and that's guilt. Guilt for feeling overwhelmed, guilt for needing a break, and sometimes guilt for even thinking about your own needs. And in many Latino families where caregiving is so deeply tied to love and responsibility, that pressure to do it all can be even stronger. But that kind of guilt can be heavy, and it can take people from asking for help when they need it the most. So part of supporting caregivers means creating a space where they can say, this is hard without feeling like they're failing. Next. So we have to ask ourselves, because this is the question, what actually helps and where can we provide that support for caregivers? Caregivers consistently tell us they need information they can trust and understand from sources that can be trusted, services that are in their language, help navigating complex systems, financial and workplace protections like paid family leave when they need to take time off, support that acknowledges their realities, and importantly, they need programs that meet them where they are, not the other way around. Oftentimes, a lot of programs require a lot of people who are already facing extreme barriers. We need to remove those barriers and bring services to communities. And what I keep coming back to, both professionally and personally, is that families shouldn't have to navigate these alone. Next. And this is where organizations like NHCOA and many of our community-based organizations play a critical role. We know that people don't always trust systems, but they do trust people. Community-based organizations can serve as that bridge. They can provide culturally grounded support. They connect caregivers to resources. And they often have sources like community health workers, promotores, and local leaders that are essential for bridging these gaps and helping navigate these care systems. Next. For caregivers who might be joining us today, I want to leave you with a few reminders. You are not alone. Asking for help is not a weakness, it's a necessity. And your health matters too. Small steps towards support can make a big difference. And while caregiving is a true act of love, it should not come at the cost of your own well-being. Next. And policy matters. If we are serious about supporting caregivers, we cannot put the responsibility only on families or on our community-based organizations. We need policy solutions. First, we need to expand access to supports like paid family leave and affordable home-based services so people can actually provide care without sacrificing their livelihoods. Second, we must invest in caregivers directly through things like tax credits, stipends, and workplace protections. Caregiving is work, even if it's unpaid. Third, we have to improve access to care by ensuring services are available in people's languages and reflect their culture. Access is not just about availability, it's about usability. And finally, we need to strengthen community-based solutions. We know that trusted organizations and community health workers are often the most effective bridge to care. We need to start funneling more money to these systems that we know work. Policy is not abstract. It shapes whether caregivers are supported or left to navigate this space alone. Next. If we want healthy aging, we must support caregivers. This means centering culture, addressing those barriers, and investing in community-based solutions. Because when we support caregivers, we strengthen families and ultimately entire communities. Next. So I want to bring us back to Rebecca. She's still caring for her father. She is still balancing work, family, and everything in between. But her story doesn't have to be one of exhaustion and isolation. With the right policies, the right resources, and the right support systems, Rebecca could have access to care in her language, financial support, and a community that helps her carry the weight. Because caregiving should be an act of love, not something that costs someone their health, stability, and future. When I think about Rebecca, I think about my own family. I think about what it means to care for the people who raised me and how much we're willing to carry out of love. But love shouldn't be the only system we rely on. When we support caregivers like Rebecca, like myself, and like many of you, we don't just change one life, we strengthen entire families and communities. Next. So thank you for your time today. And I want to highlight that NHCOA will be hosting a series of caregiver training focused on caring for the caregiver rolling out this summer. Join us on our social media, sign up for our newsletter to get notified of when these will launch. You can also always reach us on our website, by phone, or on social media for more information on webinars like this and supports like our caregiving trainings. Thank you, Christine.
Thank you, Christina, for your presentation. And just to continue with the webinar and the run of the flows. So basically, and as we close the panel session, I would like to thank each of our speakers once again. Thank you for making today's webinar such a well-informed discussion. So let's start with the question and answer session. And if you are able for all the panelists to join me and turn your video on and also unmute yourself if you'd like so. So we have several questions from the audience, and one is for Dr. Armendariz. And this is the question for you. What are the biggest nutrition challenges that caregivers face when supporting older adults at home? If you can talk to us a little bit more about that.
Of course, that's a beautiful and great question. As I mentioned before, one of the main things is that they lose appetite with time, right? And as they lose appetite, and as I mentioned, they also are they normally are less thirsty, or they don't feel thirst. So I think the best way of supporting them is, as I mentioned before, try to as much as you can and your abilities to feed or to help them feed them with high dense nutrition meals. For example, protein. I always say include protein all the time in breakfast, lunch, dinner, right? And then also add vegetables. Maybe they prefer one vegetable specifically, try with that. And also try some fruits, but like or maybe for some adults, and I see it from, I speak about my dad because I recently, he went through a situation and his appetite decreased. So what we did with him is we were like, hey, you have to eat your protein first, and then you can eat your fruit, and then you can eat your vegetable. Or and during lunch it was the same. First eat your protein, then eat your rice, and then eat eat your vegetable and then your rice. Look, try to prioritize those more nutrient because as I mentioned before, B12, as they get older, B12 is very important for the nerve system, right? And that comes from protein, high dense proteins like fish, red meat, other type of proteins. So by doing that, you will help them to actually get what they need. And also water, right? Or water is, I mean, try to give them water instead of sugary drinks and so on. And so if they like these are fine, but like make it available for them or remind them, hey, you have to drink this. They don't have to drink like 8 glasses of water, right? But they have to drink at least from 4 to 6 glasses of water. It also depends on the activity. It also depends on the season that we are at. For example, if it's summer, we tend to dehydrate more, so they might need a little bit more water. So it's just like help them in the sense of like provide them with the things that they actually need and make that those because that's one of the things that we struggle with my dad. He didn't want to drink water, so we actually gave him his bowl of water. It's like, listen, you have to drink it, and we will have to and we were reminding him all the time, Daddy, have you you drink water? Oh no, yeah, I had to drink water. Okay, so that's they forget, and they forget to eat, they forget to drink. So it's just being aware of that. And I know it's super, as I hear all the experiences, and I experience myself with my dad specifically too. It's tiring. However, is it's an act of love, right? So that's how can we help them to be on top of their nutrition.
I agree. And even if there's a possibility to have an appointment with a nutritionist, and also talk with your healthcare providers, like for more information
That
about
is
healthy
important.
aging.
Thank you for bringing that up, because sometimes maybe your person is going through some absorption problem, right? And like they don't absorb the nutrients as other people, even in they do it. So it's worth going to the doctor and seeing what's happening, if they have any, maybe in a condition that may require some supplements, right? So for them to improve that absorption of nutrients.
Thank you, Dr. Armendariz. So I have another one for Mr. Sendifer and Richard, and it is the following. How do dementia and mental health intersect, and how should caregivers approach both together?
Mhm. So that's a powerful question, and dementia is broad, obviously, and Alzheimer's is probably the leading cause of dementia there. I think, again, I'm not a clinician, I'm not a healthcare provider, but as I mentioned earlier, the circuitry in our brain, the chemistry in our brain, uh, that's one place, lots of places within one place. And the degree to which uh, patients with dementia, Alzheimer's in particular, may experience isolation, they may experience depression, they may experience all of these things. So again, they're not even separate. Uh, these things are not even separate within particular diagnosis, because we still have one brain. I mean, this fifth grader explaining this because that's my level of understanding, because I'm not a scientist, but we have one brain, and all of these conditions are operating within that space, and so it's really difficult to disconnect them, quite frankly. I would encourage always everyone for these deep questions, talk to your healthcare provider. Uh, there are some good trustworthy search tools to use as well to get good information if you want a deeper answer from a more of a scientific person. But uh, in my mind, in my understanding, because it's still one place with lots of compartments and lots of circuitry, these things can't really be separated necessarily.
It's connected too. And as you mentioned, Mr. Sandifer, it's always great to follow up and talk any concerns, any doubt, questions to healthcare providers that can provide detailed information and guidelines too. So I think we have two more, and this is for Ocean and also to Christina and everyone else that wants to step in. It's regarding caregiving. So we have this question about how can professionals better identify caregivers who do not self-identify as caregivers?
That's a very good question, and I think that's been an issue that has been around since I even started this research back in 2019. But through the research and whatnot, I think the best thing to do um, is to meet them where they're at. Rather than reinvent the wheel, rather than think about innovative ways and whatnot, it's best to work with the communities that are already working with them. I mentioned the use of trusted community health workers. I mentioned community responsive supports. And so going to places where, they receive information, whether it be barbershops cultural centers, etc., where they go to access their informal support networks. That's where you want to go to better connect and find caregivers. And also, it's important to provide in-language information when you go to these places. Again, more than 5 million adults are limited English proficient, and so it's important to use words to let them know that what they're doing can be supported with formal support networks. And so, short answer is to go where the communities are at, utilize trusted community health workers or trusted community-based organizations, and provide in-language information. I think Christine will talk about this as well. For some of these communities, there's not even a word for caregivers, and so when you're providing these when you're providing in-language information, you want to explain what the caregiving role is, rather than say caregiving, because there's no word for it. And so, yeah, go where they're at, use communities that are already doing the work rather than reinventing the wheel. And yeah, provide in-depth in-language information.
I think too, adding to what Ocean shared, is that sometimes like we are very good at like we need to name everything, right? And in some spaces, caregiving and the word caregiver is stigmatizing, right? Like I don't say that I am a caregiver in front of my parents, almost because it acknowledges something, right? Like it acknowledges that they're getting older, that they're not able to do everything for themselves. And like I acknowledge that I do the role of caregiving, but I would never refer to myself as my parents' caregiver, particularly in front of them. And so I think too, like we need to shift how we talk about things and maybe talk more about, are you helping someone that you love and care for with their medications, getting to their appointments? Are you providing meals or, spending time out of your day doing things that look like for us, our culture and our family, right? But are taking an additional toll on the other things that we have to do. And so I think, language is important, and how we frame and call things is also important. I also agree that we need to destigmatize aging, right? From the moment we are born, we are on a life course to getting older, right? But it's not until you reach a certain set number that qualifies you as an older adult or old, or all of these other senior citizen. One of the words that I really like to use is elder, because I feel like it comes with this like beautiful recognition of lived experience and knowledge. But some of these other words can feel a little demeaning, and so I think we need to be really careful with how we frame things and how we approach folks about what they are doing, because we are serving these roles. We just may not be calling it the same thing.
Absolutely. Thank you, Christina, and Ocean too. So we have another question, and it's about an attendee that mentioned, I'm not going to say names, but it says how to do some self-care without feeling guilty when providing care. If anyone can share like some tips about how this the caregiver can do some self-care without feeling guilty when providing care to a loved one.
I don't mind speaking here just a little bit. I mean, it's not the easiest thing to do, of course, right? To do that and give yourself the grace of that. And yet it's so very important, as we've heard. So I would first say to the earlier question, I want to address that too, because I had a thought there, that to the points made about caregiving and the stigma of that word sometimes, or people don't see themselves that way. They also don't necessarily understand respite, caregiver respite, which is another term in the lexicon of caregiving. And For some people, respite care might be a nice park visit, but for somebody else, it might be, I just need a gas card, or I just need a card to a big box store so I can get some things or something like that. And so to me, I think the easiest thing to do is the tip is in your informal or familial network, find those people who you know and can trust, can give you the break to say, hey, I gotta just go do some things. Can you give me an hour and take care or be on hand or something like that? I think people are often willing and able to do what they can if you package it the right way. And so um, I found in my experience, the greatest asset were the people around who could pick up a ball or handle some things in my absence. Um, and it was the famous song, "People Who Need People." Really, it really is. Really is about the people, because that's the energy and resource that you need most is people. I find. And still
Definitely. Definitely. And I just want to follow up with what Richard just said. I think, having support networks or informal support networks, someone that's there to be like, hey, can you just, give me an hour so that, or even, if it's 15 minutes to go out for a walk to take care of myself, is super important. And I think but without that, I think it's really about reframing. Reframing it as an essential and not selfish, but a necessary step for you to deliver quality care for your aging loved ones. As I talked about, the health and well-being of you as a caregiver ultimately will affect the health and well-being of the one you're providing care for. So when you reframe it like that, and you start small, whether it be a 15-minute walk or whatever, or whether I talked to a caregiver the other day, and it was simple as, I just want to be able to take a bath at night to feel better. And so yeah, I just think when you reframe it as, I need to do this, as caregivers, and especially diverse caregivers, we put our families before ourselves. And that's a positive thing. And that's, really a good thing. But at the same time, it comes with consequences. And that's, we neglect our own health. And so we need to reframe it. We need to reframe it as, I need to take these small necessary steps so that I could deliver high quality care for the person that I care and love. And so I would just add on to what Richard said with that.
And I'll tell you something that was said to me when I was ending that journey, those couple of journeys that I spoke of about my parents when they were alive. And social workers online won't be surprised by this, but I have twin cousins who were social workers at the time. And they called me and they said, you can be at peace knowing you did everything you could possibly do. And no one gets to tell you that while you're in it necessarily. But I think I raise it here because, to the question about what to do, and Ocean's beautiful point about reframing it, know that you are doing everything you can possibly do. And doing everything also includes taking care of yourself so you can take care of others, whether it's a bath or a walk or going to the mall or whatever it is, to give you the grace and the energy to recharge so that you can do that work.
Thank you, Richard. I think Dr. Gabby, do you want to say a few words, or go ahead?
Yes, pretty quick. I echo all of what others have said, but I want to remind others, because this is something that I normally see. I'm not an expert in the topic. However, I've seen people caring for others, and I have family that has been. And one of the things is like they normally forget the basic thing, to eat properly. Don't forget that you all, like, as you care for your loved ones with nutritious food, it's also important for you to eat properly, to actually, like, the same, eat your protein, your veggies, your, like, those small changes, because you need the strength to stay strong for your loved ones. So those that is small thing, I've seen it so much, and I emphasize that because I saw my mom forgetting about getting her nutritious meals, right? Because she was so focused on my dad that I was like, Mom. So I was like cooking for her and everything. So because I became her caregiver, right? So I told her, like, you need to eat properly. You need your strength. And I will also ask for help. Maybe other family members are willing to help you out, are willing to drive you to that doctor's appointment, are willing to stay with your family for a little bit while you go for a run, while you go to a party, while you go to social something. Sometimes people are more willing to help than you think. So it's just about speaking out and actually telling others how you're feeling.
Excellent. Thank you all once again for joining us. And as we are finishing this question and answer session, we would like to thank all of the attendees and also the panelists, experts for joining today's virtual event. So before closing this event, we invite you to join a growing movement of individuals dedicated to improving the lives of older adults, their families, and caregivers. And this is through NHCOA's membership program. So in the next slide, you will see more information about becoming a member. So for just $25 a year, the individual membership plan gives you access to exclusive resources, educational workshops, advocacy tools, and even bilingual information on health and aging, all while supporting us here at NHCOA, our mission to uplift and also empower our community. And to learn more or to become a member today, you can scan the QR code that it's on your screen. And today's webinar recording will be available on our YouTube channel. And also we encourage you all to follow us on NHCOA social media channels. You can find us in X, Facebook, and Instagram by using @NHCOA for more information and news of upcoming events. So thank you all once again, and until the next one, take care.
Welcome.
Bye.